The challenges that Ukrainian refugees are facing is the access to the specialized healthcare services, the access to the specialists, long waiting times to see the specialist. There is high out-of-pocket expenditure on the dental care, on the medicines, and these expenditures, the out-of-pocket expenditures, are particularly prominent among the Ukrainian refugees that are living in the temporary accommodation. So we see this sort of inequality between the Ukrainian refugees that are in the temporary accommodation versus in the permanent places of residence. Some of the barriers that also Ukrainian refugees are facing still, and this is especially prominent among the most vulnerable elderly, is the language barriers. We present a very important research study that we conducted jointly with Statistics Poland, integrating various data sources, surveys, household surveys, surveys that were done at the border crossings, integrating different administrative data sources, but also using big data such as MasterCard data, mobile operator data, to understand the health needs of the refugees, their access to the healthcare services. This use of various data sources helped us to triangulate the findings from the different surveys, such as I mentioned, the household survey and the cross-border surveys. We see that Ukrainian refugees, they do have a better understanding of Polish healthcare systems. We see quite a bit of positive developments because Ukrainian refugees, they're finding they're well integrated into the society. The majority of Ukrainian refugees, they do have they do integrate into the labor market. We see the healthcare providers, the Ukrainian healthcare professionals that are part of the Polish healthcare system now. At the beginning of the crisis, in the acute phase of the crisis, when Ukrainian refugees came to Poland, they had a difficulty to navigate the Polish healthcare system because of the lack of information, lack of understanding how the Polish healthcare system works. Various interventions, support was done by the Ministry of Health, different institutions, the cross-sectoral partnerships, the international organizations, the local organizations who were supporting refugees to understand the Polish healthcare system, how it works.